Today's topic we are going to discuss about rheumatoid arthritis. In rheumatoid arthritis, so this video is going to be a quick revision of the topics. It's not a detailed or the brief one. If you want to make me such videos, please do leave a comment. So this is just for the revision part for the look of your examination. Definition: rheumatoid arthritis. It's a chronic systemic autoimmune inflammatory disease that primarily affects the synovial joint, leading to symmetrical polyarthritis, joint destruction, and systemic complications. It is progressive and can lead to joint deformity and disability. Commonly affects women between 30 to 50 years of age. Signs and symptoms. So the symptom is joint pain, swelling, morning stiffness less than 30 minutes, fatigue, weight loss, asymmetrical joint involvement, functional impairment. Signs are synovitis, worms, swollen joints, decreased range of motion, muscle wasting around the joint, rheumatoid nodules, and joint deformities. Commonly involved joints are the wrist, MCPs, PIPs, knees, ankle, and cervical spine. Radiological features: soft tissue swelling, periarticular osteopenia, joint space narrowing, marginal erosions, subluxations, and deformity in advanced stages. Common radiographic sites are the hand, wrist, knee, and feet. Pathology: autoimmune reaction causes synovial membrane inflammation, synovitis. Formation of pannus, granulation tissue that erodes cartilage and bone. Progressive joint destruction leads to deformity. Involvement of extra-articular systems like heart, lungs, eyes, skin, blood vessels. Common deformities in RA: the deformity and its description. If it's vannic, hyperextension of PIP and flexion of DIP. Boutonniere, flexion of PIP and hyperextension of DIP. Ulnar drift, deviation of finger towards the ulnar side. Z-thumb, hyperextension of IP joint, flexion of MCP joint. Hallux valgus, deviation of great toe. Genu valgum, knock knees due to knee joint involvement. Medical management: if we are using the NSAIDs, its purpose is to maintain pain and inflammation, demand slow disease progression. Biologics target specific immune pathway. Corticosteroids, short-term inflammation control. Analgesics, pain control. And the surgical management: synovectomy, it persistent synovitis. In indications in the case of persistent synovitis, we'll do synovectomy. Tendon repair for the rupturing of the tendon. Joint fusion, orthodesis, painful unstable joint. Joint replacement, orthoplasty, end-stage joint destruction, hip, knee, MCPs. Physiotherapy assessment. When for the pain, we'll use a VAS and a visual analog scale. For the joint range of motion, goniometer. Muscle strength, MMT, focus on affected joint. Deformity observation, visual inspection or the palpation. Functional status, hand function test and walking ability. Fatigue level, fatigue severity scale. Grip strength dynamometer. PT aim and management. In acute phase, that is inflammatory phase, the aim is to reduce pain and inflammation, to prevent joint stiffness and deformity, and also to maintain the mobility and function. When we talk about the management in the acute phase, rest and joint protection, cold therapy for pain, gentle passive and active assisted range of motion, splinting to prevent deformity, positioning to avoid contractures, educate on joint conservation techniques. Chronic stage, remission or stable. The aim is to improve muscle strength and endurance, correct the posture and alignment, promote functional independence, prevent disability. The management parts will be active and resisted exercise, that is pain-free, low impact aerobic exercise during walking and swimming, stretching and flexibility exercises, postural correction and gait training, heat therapy before exercise to relax the tissue, and balance coordination training. When we talk about the HCP home exercise program, the general principle is exercise daily during remission and less intense during flare-ups. Avoid over-fatigue, emphasize joint protection, include rest breaks. Use adaptive tools and splints when needed. Sample for HCP for RA of knee, hand and ankle. Hand exercises, finger flexion and extension. Tendon gliding exercises. Squeeze a soft ball if pain-free. Thumb opposition exercises, wrist circles and gentle stretches. Knee exercises, isometrics, quadriceps contraction, press knee down. Straight leg raises, hamstring stretches, knee slides, that is knee flexion, mini squats against the wall if tolerated. Ankle exercises, ankle pumps, dorsiflexion and plantar flexion. Alphabet exercise, trace letters with toes, Calf stretches, toe toe, heel toe rises if balance is stable. Advice on joint protection. Use assistive devices, jar openers, reaches, avoid tight grips or healthy lifts. Maintain proper posture, use plants or orthotic for support. Pace activity to avoid fatigue. Summary table. So the definition of RA is autoimmune inflammatory arthritis symptoms, joint pain, stiffness, less than 30 minutes swelling. Pathology synovitis, pannus, cartilage destruction. Deformities, Van neck, ulnar drift, zetum. Medical treatment, DMARD, NSAIDs, biologic steroids. Surgical synovectomy, joint replacement, or orthoplasty, orthodesis, etc. PT for acute stages, pain relief, joint protection, gentle range of motion. For chronic stages, strengthening endurance and posture training. HCP, that is home exercise program for hand, knee, ankle, focused exercises with pacing. Hope you guys learned something new today. Happy learning.